Welcome, ladies and gentlemen. We are in House Health Subcommittee. It's Tuesday, March 21st. It is 1:30 p.m. And Ms. Adams, would you please call the roll?
Representatives Hicks. Here. Representative Jernigan. Here. Leatherwood. Here. Martin. Here. Mitchell. Here. Sherrill. Here. Terry. Here. Williams. Here. Chairman Hawk. You have a quorum.
All right, thank you. We have a quorum. Anyone have any personal orders to come before the committee? I do have a personal order if no one else does. We are honored to see many individuals in the room, folks with our members of the Tennessee Association of Nurse Anesthetists. If you all please would stand, some of our students and our nurse anesthetists, please stand. Wow. Welcome. Thank you very much for being here. Glad to have you here. Appreciate your advocacy work. Seeing no further personal orders, ladies and gentlemen, we do have a calendar to get to. We will go through in order. We are on item number 1 on our calendars, House Bill 1380. Chairman Reagan, you are recognized.
Thank you, Mr. Chair. I request this be rolled to the heel of the calendar.
The request has been to roll House Bill 1380 to the heel of the calendar. Without objection, bill is rolled to the heel.
Mr. Chair, I also have item number 5 on the calendar.
Okay, ladies and gentlemen, we will now go to item number 5 on our calendars.
And I request to roll that to the heel as well.
Calling up House Bill 1379, item number 5 on our calendar, House Bill 1379. The request has been to roll this bill to the heel of the calendar. Without objection, your bill is rolled to the heel.
Thank you, Mr. Chair and Committee.
Thank you, Chairman. Chairman Williams, you're recognized.
Just a quick housekeeping. It's not really shown on my marked calendar, I don't think. How many times were those two bills? I know we may run out of time today, but can you tell us how many times those two bills were calendared prior to or including today?
Item number 5, 1379. This was the first time it's been calendared, so this was the first roll for item number 5, House Bill 1379. Item 1380, this is the third time it has been on a calendar. We have moved the bill to the heel of today's calendar with the hopes that we can get to the heel of today's calendar before we finish. So we're in a bit of a sticky situation on that one, but hopefully we'll get to the end of the calendar and we'll be able to address that. Chairman Williams.
Thank you. Just as a clarification, we might, before committee ends today, my suspicion is we have a full calendar. We're not going to get to all the bills. But if it's my understanding, based upon we did have some rule changes, that as long as the committee adjourns prior to getting to the heel, that bill would be before us again next week on the third calendar.
With the heads nodding yes in the room, that is my understanding is where Chairman Williams.
Thank you.
Chairman Terry, did you have any clarifying? Okay, we're good there. All right, thank you very much. We are now going to item number 2 on our calendars, House Bill 952 by Chairman Boyd. Chairman Boyd, you are recognized. We have a motion. We have a second. You are recognized. Chairman Boyd, 952.
Thank you, Mr. Chairman, Committee. And, Mr. Chairman, I do have an amendment for this bill.
House detects, or the Chairman detects, we have 2 different amendments. Are we looking at...
Drafting Code 5507 is the amendment I'd like to take out,
All
Mr.
right,
Chairman.
we have Drafting Code 5507. We did hear a motion. We have a second. We'll go ahead and get this amendment on the legislation and allow you to discuss it when we move forward. All those in favor of placing Amendment Drafting Code 5507 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill is amended. We did have another amendment drafting code, and it, pardon me just a second. Chairman Boyd, you may not have that. It was a potential amendment that may or may not be in your packet, and it sounds like it's not in your packet. Okay. All right, you are recognized on House Bill 952 as amended. You're recognized, sir.
Thank you, Mr. Chairman. Members, House Bill 952 is amended. It goes back, and just to give you a little background, the Certificate of Need Reform Working Group has been meeting since 2019 to propose various reforms to the program in a way that is both strategic and methodical to reduce disruption to the industry and services to patients in Tennessee. And so this cleans up the statute for the Health Facilities Commission, and it would go into effect upon passage of this. And basically what this bill does is it consolidates the Certificate of Need Board and the Licensing Board to create a new 15-member board that would be called the Health Facilities Commission. The consolidation of these boards would go into effect on July the 1st of 2024. And the Health Facilities Commission would oversee the Certificate of Need program and the licensure and regulation of health facilities. And Mr. Chairman, I know that when we talk about Certificate of Need, it normally conjures up long, detailed things. This is really that simple. That's what this bill does.
Thank you very much. Any questions or comments for the sponsor? Surprisingly enough, seeing none. Are you ready to vote? All those in favor of sending House Bill 952 as amended to full Health Committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Mr. Chairman of the committee. Mr. Chairman, I have a bill just a couple of spaces down. If it's possible to take that up while I'm here. If it pleases the committee, please.
Chairman Williams.
Let the record reflect the chairman of finance grimaced when Chairman Clark Boyd asked that question.
Without objection, we will go to item number 6 on our calendars. House Bill 1095, you have a motion, you have a second. Chairman Boyd.
Thank you, Mr. Chairman of the committee. And Mr. Chairman, I do have an amendment, and that drafting code is 4871.
We have a motion. We have a second on the amendment. Let's go ahead and get that bill in the proper posture. All those in favor of placing drafting code amendment 4871 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. You are on House Bill 702 as amended, sir. You're recognized.
Thank you, Mr. Chairman of the committee. So last year, I passed a piece of legislation that created a study committee to study the cost that temporary staffing agencies were costing long-term facilities in Tennessee. And the results came back and indicated, just to give you a little bit of contrast between how much it's gone up, in 2019, nursing homes spent about $10 million on temporary staffing. In 2022, it was over $100 million for temporary staffing. Assisted living facilities, it went from $170,000 in 2019 to $4 million in 2022. So what this bill seeks to do is to hold these temporary nursing staffing companies that work in the long-term care industry, to hold them to the same standards as long-term care facilities. So this bill would require these staffing companies to register with the newly created Health Facilities Commission, and they would submit a report twice a year. They would have to meet all of the licensing, certification, training, and continuing education that the nursing homes would have to do. The staffing agency would have to complete all applicable state and federal background checks, workers' name, make sure it doesn't appear on the sex offender registry, the abuse registry, and ineligible persons registry. And it would require staffing agency to maintain workers' compensation insurance, liability insurance, and retain the records for 5 years, along with a series of other things that would be required. But Mr. Chairman, I will save you all that long list. It is in the bill, and that is what this bill seeks to do, Mr. Chairman.
Thank you, Chairman Boyd. Any questions, comments for the sponsor?
Yeah. Is there,
Chairman Jernigan, you're
it
recognized.
says the fiscal note's not yet available. Did you ever get one, or do you?
Chairman Boyd,
Thank you,
you're
Mr. Chairman.
recognized.
So the fiscal note that I have here says that it would increase state, it would be one of those increase and decrease of the same number. So it doesn't
Okay, I
Yeah,
just didn't have
be-
one on mine. Thank you.
inconsequential.
Within departmental costs, it looks within,
right.
within the organization, I believe, is how it will affect. Any further questions or comments of the sponsor? Seeing none, are you ready to vote? All those in favor of sending House Bill 1095 to full Health Committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Mr. Chairman, committee.
Thank you, Chairman Boyd. We are now back to item number 3 on our calendars, House Bill 496 by Representative Martin. You're recognized, sir. Forgive me, Representative Martin had to step out and is running a bill in another committee. We will, without objection, Chairman Terry, I was going to say, without objection, we're going to move on to item number 4 on our calendars, which is the recently grimacing Chairlady Hazelwood. Chairlady Hazelwood, you are recognized with a smile and a motion in the second. I believe you're going to have an amendment on your bill.
That's right, 005033.
We have a motion. We have a second. We're working on House Amendment Drafting Code 5033 to place on the bill. All those in favor, please signify by saying aye. All opposed, please say no. The ayes have it. Chair Lady, we are working on House Bill 315 as amended. You're recognized.
Thank you, Mr. Chairman. The legislation before you will reduce the total number of private beds in intermediate care facilities for individuals with intellectual disabilities available in Tennessee upon the voluntary surrender of the certificate of need for such beds by the owner. As you may know, Tennessee has done yeoman's work in getting programs like Choices, other programs underway that allow folks with developmental disabilities as well as the elderly and some other folks to stay in their homes longer. With that, there's sometimes not the need for as many beds in the ICF status as we've had before, and this bill has been worked in conjunction with those providers. The amendment does do some things to clarify and to address some issues. Some of the providers, like My Orange Grove in Chattanooga, Life Bridges, some of the other larger providers across the state do have and have frankly put a lot of investment into group homes and that sort of thing, and they have great results with their patients who really want to be there, who feel cared for and nurtured there, who have folks that not only take care of their physical needs, but help them get to jobs and all sorts of other things. So the amendment just simply puts a floor on the number of beds available as well as a ceiling. And with that, I would just answer any questions that your committee may have.
Thank you, Chair Lady. Chairman Jernigan, you're recognized.
Yeah, mine's not a question, more of a comment, and just, I'm signed on to this bill, and it's an excellent bill. And anytime that we can, these ICFs are, they're small institutions that we were able to comply with Homestead with, but whenever we can get individuals with disabilities into single homes, to be more mainstream, and to be able to support them there with their quality of life and where they're going to go forward with maybe getting a job and having the support there. This administration bill that is a good one, and just want to thank you for carrying it. Thank you.
Well, thank you, and I will say that in addition, the amendment in addition to the floor and the ceiling that I mentioned, it also makes sure that when folks are being given their options, that they're given those options in an even-handed way, that nobody from the department is trying to put a thumb on the scale and kind of suggest or direct people to one option or the other. People have all of the facts, and they and their families will be able to make the best decision for that particular case. So I think that's an important piece of this legislation as well.
Thank you. Any further questions or comments of the Chair Lady? Are you ready to vote? All those in favor of sending House Bill 315 to full Health Committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward. Thank you.
With an even bigger smile, I say thank you and goodbye.
Yes, ma'am. Ladies and gentlemen, I'm going to have to, forgive me. Bit of a conundrum at the moment. I have to go present a bill, and other members have to go present bills as well. If it's all right, I'm going to pass to Chairman Terry.
All right. That brings us to item number 7, House Bill 1317. Chairman Kumar, you are recognized. You have a motion on your bill, and I believe there is an amendment.
Yes, Mr. Chairman, it's barcode 5859.
Okay. You have a motion and a second on your amendment, so if there's no objection, let's go ahead and put the amendment on the bill. All those in favor of Amendment 5859, say aye. Aye. Opposed? Ayes have it. We're back on the bill as amended. You are recognized, Chairman Kumar.
Thank you. Mr. Chairman, this has to do with the Board of Pharmacy for the state of Tennessee, and this bill seeks to strengthen the Board of Pharmacy and their function administratively as well as around various appointments. The bill seeks to enlarge the board from 7 to 9 members and appoint an additional member who's a pharmacy tech. This will be a first addition. And secondly, bringing people in who are regular practitioners of pharmacy and not administrative alone. The focus is on patient care and improving qualifications of the members and increasing their appointment from 6 to 7 years. Again, the idea is for the board to be functioning better, have more input, and have working pharmacists on the board. There are a few concerns from the department, and we are working with them and hope to resolve them by the time this bill hopefully progresses to the next level.
All right. Do we have any questions for the sponsor? Okay, I do have a request from the Department of Health to speak on the bill, so without objection, we will go out of, are they here?
Yeah.
We'll go out of session. Yeah.
Thank you, Mr. Chairman. Appreciate your all's time this morning. My name is Olivia Spears. I'm the Assistant Commissioner of Legislative Affairs with the Tennessee Department of Health. With me today is Mary Catherine Bratton. She's the General Counsel of the department, as well as Dr. Lucy Schell. She's the Executive Director of the Board of Pharmacy. As the bill is written currently with this amendment, the department is philosophically opposed to House Bill 1317, which allows the Board of Pharmacy to employ persons it deems necessary to properly conduct board business. It also allows the board to dismiss the executive director. Allowing the board to hire employees to conduct board business is both problematic and concerning. First, this would allow the Board of Pharmacy to conduct employment hearings on the record in a sunshined meeting that would be memorialized on the board's website. This means that individuals will be hired and fired on the record in the public eye. The department is opposed to subjecting the executive director or other employees to this. In addition, there would be no day-to-day oversight on whether the employees that were hired were doing their job correctly or efficiently. Further, any HR issues or complaints would also be dealt with and addressed in a sunshined open meeting for the public to watch. Secondly, these employees could not be properly audited. For example, if a board hired a finance employee, it is unclear whether that financial information would be available to the department, the executive branch, or the legislature. There would be less transparency in the board business. In discussing this bill, it was mentioned that this provision was to enable the board to hire a second attorney. This creates privilege issues as documents created by that attorney and between the board, would be subject to attorney-client privilege. It would create confusion for the board to have two attorneys advising them on their business. It is also unclear how cases, information, or other related business, such as rules, would be handled. It is unclear and unlikely that this information would be available to the legislature, the department, or the executive branch. Lastly, this would cause delays for the board to complete its normal course of business, as the board would be spending more of their time overseeing employees or hiring and firing employees. With that, we're happy to answer any questions the committee may have.
All right, thank you. Do any of the members have any questions while we are out of session? I do have a question, I guess. From y'all's standpoint, as far as the function of the board right now and with the director, have there been issues? Have there been concerns that have been brought up? Or as far as the functioning, do you see that there's room for improvement that this bill could potentially address? And if so, how could this be amended to get to that point?
I'll go first, and then I'll let any of my colleagues join in on that. To my knowledge, there has not been an issue, at least until this legislation was brought. Then I think some conversations were had. I do think that this, especially the employment provisions, would not fix that, would just cause more issue and more confusion. And I will defer to my colleagues at the table if they want to add anything else to that.
For the record, who you are and your role, please.
Thank you. Mary Catherine Bratton, I'm the General Counsel with the Department of Health, the also General Counsel. We do not have any complaints against the employees that have been lodged with us. That is something that we would take very seriously. And prior to this bill being filed, we had not received any. There was at the last board meeting last week a little bit of confusion, I believe, on the part of some of the board members about the case process when cases are presented to them. Because they sit as the jury and hear cases, they are not permitted to have information ahead of time. Similarly to the prosecutorial process in the criminal realm, a grand jury is not the same as a jury. A grand jury hears the complaint information, hears information about a case, and decides whether it should go forward. And the jury members are not the same individuals because they would be privy to all sorts of information that would not be admissible in a court. There are ways that we would be happy to discuss changing the statutes to allow the board members to have a similar process to the grand jury and jury, like in the criminal system. This bill does not address that, and if the board were to hire their own attorney, that attorney would still be bound by the requirements of the board members not having information that would prejudice them prior to sitting as a jury on a case. So it doesn't actually address the issue that we have had raised to us.
Do you have any, as far as the board makeup, any changes to the board makeup? Do y'all have any comments?
No, sir. No, sir.
All right. Chairman Jernigan.
Thank you. And that was one question I was going to ask. You have no issue with the makeup of the board, right? Okay. Second is, so if they're able to hire their own staff, this could be attorney, accountant, it could be anything that they deem necessary from a professional standpoint outside of the Department of Health. So when how does the sunshine laws affect this?
I'll go first, and then if Mary Catherine wants to jump in. It's my understanding that all of this would be in a sunshined meeting. As for documentation that's created for these employees, I'm not sure how that applies, but I do know that any sort of hiring or firing of an individual would be on a sunshined open meeting.
So if they hire their own staff and you don't know what's going on, I guess, so to speak, you're not in the know. There's no communication between the two. Then at the end of the day, the state and Department of Health will be on the hook for what happens during these sunshine meetings. You're not in control of the narrative, I guess, for one thing. I get that. But there could be violations of the law, I guess, in open sunshine. In open. And then if that's the case, does that stay with the board and them have to deal with it, or is the Department of Health already tied to that and they're going to have to be involved anyway, if that makes sense?
I think it probably depends on the factual I'm sorry, Mary Catherine Bratton with the Department of Health. I think it probably depends on the factual circumstances. If they hire someone who independently commits a bad act, I'm not sure that would come back to the Department of Health, but the state represents the board. So if the board takes an illegal action and is sued, or seen as taking an illegal action and is sued, the Attorney General's office would still represent the board. And if they were doing that based on a private party's recommendation, that could become a little bit problematic.
And I guess my last question, are there any other are there any, well, she'll tell me, are there any other boards that have their own staffing?
No, sir.
Okay, thank you.
Thank you, Chairman Jernigan. It's good to be back. And Siri was about to answer your question. I heard her answering that. Chairman Williams, you're recognized.
Thank you, ladies, for coming. Just as a follow-on to his question, was there a concern that the board had that they felt like the current general counsel wasn't serving in an appropriate way or wasn't answering the questions that they need? I guess I'm trying to find out why the board feels it necessary to hire their own outside general counsel to help represent who they are. If it's the Department of Health's within their purview to represent the board and defend the board, then why would the board deem necessary or request a change in order to do so?
Thank you. I think we're trying to figure that out as well because the current general counsel does a fantastic job. And in fact, there was a comment about the work that he does in a prior committee meeting about this bill. So to answer your question, I don't know that we understand it fully either. However, I will let Mary Catherine add to that since she is the general counsel of the department.
Got it.
We have not heard any complaints about their attorney. They have given me nothing but positive feedback. Our door is always open if there is a complaint, but we can't solve a problem we don't know about.
Thank you. I'm concerned I'm beginning to see a trend as it relates to health-related boards. We had a health-related board committee in here just a couple of weeks ago, issue with the board. They threw them into sunset. We ended up having to reconstitute a board. It just feels like Groundhog Day, and I really don't understand why it is that we're doing this or the need to do it. And so maybe that's more of a question for the bill sponsor. This looks like a solution in search of a problem. But I understand your view, and so I look forward to talking to Chairman Kumar.
Still out of session. Chairman Terry, you're recognized.
Thank you, and this is for the executive director. Have there been any issues or concerns that have been brought to you by the board in how you're working with them, and if so, if they have their authority based on this bill, would you expect to still be the executive director? I mean.
Lucy Schell, I'm the Executive Director for the Board of Pharmacy. Typically at every board meeting, I ask the board members for any feedback, any questions, any room for improvement, and there has been none or any comments to myself about any improvements that I personally need to make as Executive Director of the board.
Thanks.
Representative Mitchell, you're recognized.
And thank you, Mr. Chairman. I think y'all answered this, but I want to just have the question direct. The question was asked, does any other commission or have staff? My question is any other board or commission allowed to hire an attorney or have an outside attorney?
So I want to be clear, I'm only speaking for the health-related boards that are attached to the Department of Health. There's not any separate authority for them to hire their own attorney. Historically, we did have one instance where an attorney had to recuse themselves, and the governor's office gave a board permission to hire outside counsel. And in the event that that unusual one-off circumstance were to happen again, the same thing could occur. But no boards attached to the Department of Health currently have independent authority to hire their own attorney on an ongoing basis.
Thank you.
Any further questions or comments for the presenters? Seeing none, ladies, thank you very much. Appreciate that. We are back in session. We are back on House Bill 1317 as amended. Chairman Kumar, you're recognized for some questions and comments. You're recognized, sir.
Yeah, thank you, Mr. Chairman. Thank you. This bill originated in the Senate with the Speaker Pro Tem, who himself is a pharmacist and is more knowledgeable about it. The department has been in consultation, negotiation with him, and the differences are being hammered out. Certainly, overall, generally speaking, sunshine is not a bad thing. It's the law, and it does expose things. And whether the board has hiring and firing authority, that too, it should be the board prerogative. And the things will be more open and available to the department itself. And again, adding members of the board that are practicing pharmacists than just administrative people, as well as a pharmacy tech, that itself is a good thing. I would ask that since the negotiations are still going, I don't think the bill is finalized enough for the committee to make a real determination. If depending on time, we can either roll it to.
Chairman Terry, you're recognized.
I'll yield to Chairman Terry.
Before we get to that, I saw Senator Hale in the back, and I don't know if you saw him walk in or not.
Yeah.
And I was wondering if we could go out of session and hear from Senator Hale, if he had any comments that he might have some. Is that? Oh, that's right. It's not 24 hours.
Does it apply to?
Yeah. Yeah. Yeah.
Senate members, I don't know about.
I have been advised that at my own peril to recognize someone whose name is not on the list, that I will recognize Speaker Pro Tem Hale, if you would like to discuss this legislation, sir. And if I suffer any slings and arrows, I may have to come your way.
Go to session. Out of session.
Without objection, we will go out of session and recognize Senator Hale. You're recognized, sir.
Thank you, Mr. Chairman. Are we on? There we go. Thank you, Mr. Chairman and members. I'm walking into discussion here, and I don't know at what level where we are in this discussion. So let me just go back to a little bit of the beginning of how this has come about. And it had come to my attention that the Board of Pharmacy, and this has expanded to other boards, that the board is not actually having all the information in front of them. That the reports from the inspectors, and this came to me from an inspector, and then from other individuals concerning how the board's operating, that the department is seeing the information that come from the inspectors, and that information is being scrubbed before it goes before the board. Now, there has been conversation with the department concerning the legal aspect, legal concerns concerning this. But at this point in time, I feel like that the boards, it's not just the pharmacy board, but other boards are not getting all the information that they need in making decision process. And I've had individuals in my office that serve on these boards, and I've asked this question, are you getting all the information to make the proper decision? The answer has consistently been, no, I don't feel like that we are. I've had conversations with the department, understand the legal, and this has, I want to pause also and say this has nothing to do with the attorney, with Matt. He's excellent. He does a great job. I have a tremendous amount of respect. This goes back to policy of the department. And I think they recognize that. I have viewed the Board of Pharmacy on March the 14th, the end of that. There was a lot of discussion concerning this, and it was admitted that the information that's given to the board is scrubbed before they see it. I think that's a real problem that needs to be addressed. And so that's kind of the genesis of this bill. And I'll be happy to answer any questions concerning that.
Thank you, Senator. Chairman Williams, you're recognized.
Thank you. Thank you for coming to the lower house today. Senator. I will say
I didn't say
do,
that.
I know I did. So this does give me great concern because prior to you entering the room, so a Senate colleague, a former Senate colleague of yours, sent a bill or a group into sunset and tried to reconstitute the board because they were having problems. I think at some point in time, if you just found out in the last meeting that there was a problem and that the staff was scrubbing, using your word, scrubbing the data or information that's being presented to the board, seems to me like the best bet, if you're just finding out about that, would be not to reconstitute a board, hire a new person, use existing revenues on hand in order to do so. It seems to me like that to make such a dramatic change would be not in order. If you could tell me what I'm missing.
Recognize Senator.
I'm not sure that you have the correct amendment in front of you. We are not reconstituting the board. The board continues as it is. We're adding two positions, one for a pharmacy tech position on the board and one additional pharmacist. We're putting in some requirements for the pharmacists that they have to have, that serve on the board, have to have recent patient care. We're not looking for someone that has been in an office somewhere for 25 years. We want somebody that's had their hands, so to speak, in the business, that they have had patient care, experienced recent patient care to be serving on the board. The Board of Pharmacy and all the health-related boards are concerned about patient care. And for them to make proper decisions, then that needs to be applied. And so we're not reconstituting. We originally did, but that's not the intent that we're going with the amendment.
Chairman Williams.
Thank you. Just the amendment that we have, just for communication, the amendment we have, 5859, I believe, is the amendment which is before us.
Correct.
In my March calendar and in the amendment form of the bill itself, it says it rewrites the bill and vacates the Board of Pharmacy and changes it from a constitution from 7 members to 9. Could it be that we don't have the same amendment that the good senator is currently talking about?
We'll take a moment of pause or Senator, can you address that? Senator Hale, you recognize.
It's just whispered in my ear that the amendment is correct, the summary's wrong. But I don't know if that's true.
The amendment's correct.
Forgive us as we take a moment to reread and see if we can better clarify Amendment Tracking Code 5859. Since we're out of session, as I'm reading the amendatory language, 63-10-301 designation, subsection A, there is created a Board of Pharmacy. We're trying to get an interpretation of exactly what that means from legal. I'll give her a moment to decipher that, and we may hear from legal in just a moment. Subcommittee and Senator Hale, we are in a bit of a quandary at the moment. We are looking to GovOps attorneys as well. Historically, different language is used if a board will continue and have members added to it. The interpretation of our attorneys on this side and research staff is that, as the language states, there is created a board of pharmacy that looks to begin from anew a board of pharmacy. Although members currently sitting on the board can certainly be re-engaged as members, the appearance seems to be a reconstitution, both a vacation and a reconstitution of the Board of Pharmacy, which we've got differing opinions on at the moment. Chairman Terry, you're recognized.
Thank you. And to add to that, it says amended by deleting the part. And so we are deleting and then creating. And so I think that would mean that we were reconstituting, but I'm not an attorney.
Thank you, Dr. Terry. We may go ahead. Chairman Jernigan, you had a question while we're out of session? Or do we need to get some clarification before you go forward? We have other members if you do. Representative Mitchell, you're recognized.
Yes, Senator, if what you're saying is true, and I have no reason to doubt, that materials are being withheld from the board and things are being scrubbed, I'm just thinking, you may be aiming at the wrong people here. From working in previous administrations, I just don't see an executive director of a board going rogue. You may have one or two, but they don't stay around very long with most governors. For stuff like that to be scrubbed, it's coming on up the food chain from deputy commissioner, commissioner, governor staff, governor level is doing that. So I think you may be aiming at the wrong people. You may need to add these other people to the board, but I just think your aim may be at the wrong people with this piece of legislation.
Senator Hale.
I'm a little puzzled by your comment because I sense what you're saying, that I'm aiming at the board. I am not aiming at the board. I think that we have a issue between the department and health boards in general. Pharmacy board is the one that's kind of drawn the attention here, that there is some conflict in the position of the department and being able to allow a board to make decisions with information, the proper information in front of them. I've had discussion with a board member today that was rather lengthy on some solutions to that, but we think that we need to have this in front of us to keep the communications open. The department certainly indicated that they're willing to work. This just continues to help that. Going back to, Mr. Chairman, the vacating of the board, that is not the intention. The original language was there. We took that out. So I don't have any authority here at all, zero. But if we could get some time to maybe get that detail worked out and language redone, whatever the sponsor of the bill here and
Representative Mitchell, you're recognized.
Yeah, Senator, I appreciate your clarification, and I think you're right. You may be getting the attention of the department, which they may need, but I think we need some personality correction instead of fundamentally changing the way this board operates. But you may have your tool to get their attention to correct those personality deficiencies.
Senator Hale.
I would push back just a little bit on that, Representative, in that I don't think this is personality. I think this is some policy that has drifted in that we just need to adjust.
Chairman Jernigan.
I remember so this is good. When the Department of Health came and spoke, I'd asked them if this is about hiring staff, and I'd asked them if any other board hires staff, and she said no. But I was kind of curious, when you're able to hire staff, then the autonomy to do so, it can go beyond an attorney, it could be a CPA, it could be any staff that you all deem necessary, whether it's in the scope or not of the Department of Health. Is that your understanding, how broad that is?
Senator Hale?
I understand your concern there and the department's concern. We had conversations about removing that part of it, but what we did last year was that the executive director would be hired and fired by the board. The inspectors need to be under board authority rather than department authority. How we make that work, I think, is up for discussion and negotiations. I'm not intent on the department, on the board taking on a lot more expense, taking on personnel. This is a vehicle for discussion to continue and to come to a solution.
I think I'm okay. I would be more comfortable if there was a cap somewhere of where you start hiring additional profession to what the board may think will supplement them and work even better, but it's unprecedented that no other board has hired this type of professional staff in addition to what's already there. So if you capped it like just an attorney, or you made your scope very, very limited, I think he'll let you talk back and forth.
Senator Hale, you're recognized. Forgive me.
I don't disagree with that.
Okay. Thank you.
Thank you. Chairman Terry.
Thank you. And to your point, there are boards that are under the Department of Health that I know that are having some issues. And to me, it's about accountability, and it's about the ability for these providers that are putting their time and effort into this and putting their reputation on the line as well, to be on these boards, to have the information that they need, to do it in an efficient manner. And if it requires that these boards have extra accountability, how we get about that, I'm not sure. This may need to be reworked to get to that. But you are correct in like I said, we have my process sheet and the premise. Your premise is correct. Our goals are for these providers to do what they need to do and to do it efficiently. We're at the point here we're talking about options and the feasibility of that, but I do agree with your premise. Thank you.
Thank you. Any further questions or comments of Senator? Thank you, Senator Hale, very much. There has been a request for the presenters who came with the Department of Health earlier to come back to address some concerns that we may have heard. Is that accurate? We have had discussions with attorneys, and I think I can relay the information. The drafting of the amendment, Chairman Kumar, you're recognized. Well, we're still in recess. Forgive me. Can I address? I'll address what the attorneys have said. Advice from legal is that the amendment could be drafted better. There needs to be a rewrite to clarify the language that we have seen as somewhat ambiguous, as well as include a sunset provision, which would be included with normal boards and board creation. So I think that may need to be a part of a rewrite as well. I think Dr. Kumar is wanting to say some things. Chairman Williams.
Thank you. I think that Dr. Kumar and I have known each other for a couple minutes, and I know his wife, Linda, pretty well. I have a feeling he'd like to work on this. If we could go to the Hill, he might be able to work on it and maybe wait on the same clock.
Without objection, we are back in session. Chairman. Chairman Dr. Kumar, you're recognized.
Thank you, Mr. Chairman. Thank you, gentlemen. I did not know that the department was going to testify and had issues with it until I came in here. So obviously there are a few loose ends about it all. This turkey is still in the oven and not fully baked. Okay. So kindly, depending on the committee schedule, kindly give us more time, or either to the heel of the calendar or roll it for a week, whichever pleases the committee.
The proper motion will be to roll this bill to the heel of today's calendar. Without objection, your House Bill 1317 is rolled to the heel.
Thank you, Mr. Chairman, and thank you, committee.
Thank you. All right, thank you, ladies and gentlemen. That was very interesting, a case study in how we make laws in the state of Tennessee. Thank you very much. We are now back on item number 3 on our calendars. Representative Martin had to step out of the room. Now he is back in. Item number 3, House Bill 496. We have a motion and a second. Representative Martin, you are recognized. Do we have an amendment, sir?
Yes, sir.
Oh, sorry about that.
Work. Yes, sir, Chairman. Amendment number 5564.
All right. We have a motion and a second on Amendment Drafting Code 5564. Well, let's go ahead and put this amendment on the bill. All those in favor of placing Drafting Code Amendment 5564 on the bill, please signify by saying aye. Any opposed, please say no. Your amendment is on the bill. We are back on House Bill 496 as amended. You're recognized, Representative Martin.
Thank you, Chairman and Committee. The current law has no statutory time frame that requires a health licensure board to issue a license. So this bill will establish a reasonable time frame for those boards to do so. It would set a 60-day time frame for the department to make that decision. This would allow the workforce to get to work quicker and then also help address some shortage concerns in the state. This legislation will impact the professionals that support it, as well as the language has been approved or worked out with the Department of Health. So I stand ready for questions, sir. Thank you.
Thank you. And if you'll recall, last week we had a similar bill that Chair Lady Hilton Haynes was working on, and this is somewhat in conjunction with that. We had some, I think if we could have gone on to your bill last week, we might have been able to answer some questions that were that had occurred on her legislation, but I think this is a companion piece of legislation to that, which gets us all in line in terms of days, times, meetings, and things of that sort. So, any questions or comments for the sponsor?
Question on the bill.
Questions have been called. All those in favor of sending House Bill 496 to Full Health Committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chairman.
Thank you. All right, I'm going to look for some sponsors. We have individuals having to be at 3 different places at the same time. We're gonna follow our calendar. As I look across the room, we're going to item number 10 on the calendar. Chair Lady Moody. Chair Lady Moody, we're going to recognize you on item number 10 on the calendar, House Bill 634. Chair Lady, you have a motion, you have a second. You are recognized as you come to the podium, ma'am.
Thank you, committee and Mr. Chairman. This bill that I'm carrying today is part of Senator Hale's. Did he stick around? But Chip here? Okay. Well, that's okay. He won't know if I messed up. So, right? No, but this is part of that package that he has for our children and families. And what this particular bill that I'm carrying will do is trying to address the shortage of childcare that we have in our state, and the demand is high. But what this would do, let me get the right words right. This would start. Here I go. This bill will create the Child Care Improvement Fund, and DHS would administer the fund, and they would allocate and disperse grants each fiscal year from the fund to nonprofit organizations for specific purposes, either for establishing a new agency, making improvements to an existing child care agency, or assisting with staffing, recruitment, or salary gaps at an existing child care agency in this state. So could give you more information if you have specific questions, but that in essence is what this bill will do.
Thank you, Chair Lady. Is this a new source of revenue? These are new dollars we're talking about bringing into the state. Is that correct?
Yeah. As Chip explained it to me, they were hoping to be able to use federal and state money.
Chairman Williams, you're recognized.
Thank you. Why only nonprofits? I guess the question for me is, in a lot of our rural communities, nonprofit childcare is only a small component of the overall number of children providing care. If we only provided care to nonprofits, it seems like that the distribution of those funds wouldn't be as equally distributed. Was there any consideration at all as to how those monies might be separated? You know, sometimes we do it by grand division or by Senate or House district. Any thoughts to that?
Chair Lady Moody.
Unfortunately, I'd have not, in my reading the material I've been given, that didn't come to my mind to ask that, and I don't see that I can properly answer that at this moment, unless Chip is still in here. I apologize.
Chairman Terry.
Thank you. How would this work different than like the Child Care Development Fund that we have? I mean, are you asking the feds for different dollars that come down that would go to the nonprofits, or are you looking at trying to utilize similar to what we did with TANF dollars and put a program to where we can utilize those funds? Do you have any answers on that?
I would be speculating, to be really upfront with you. Like I said, those questions did not come up in my discussion with them. And
Chairman Terry, follow up?
No, I was just trying to, because we have, one of the issues that we do have is like much that we have with TANF, we have the CCDF funds, and there is a shortage of facilities in the state of Tennessee, right. And because of the supply and demand being in short supply, they're charging cash prices for taking care, and they don't want to deal with the overhead of dealing with government, and so those funds do pile up. And so I just didn't know if this was another way, if you've been able to use those funds, and that was basically what I was trying to get at, and those are some questions that I would need to get answered.
Chair Lady Moody.
Some of those statements you made, I did read in here, but it didn't get into the weeds about TANF, and although I'm familiar with all those, I would.
Chairman Williams.
Thank you. I did notice it's beginning to make a little bit more sense when you look into the fiscal note. It looks as if we're creating a recurring $15 million fund, like a trust fund, of which net proceeds through investments with the treasurer would be able to be used towards nonprofit child care. Is that pretty good summary of what your bill does?
Chair Lady.
Mr. Chairman, thank you. I did find that page just now, and that's my most recent information. Yes.
Okay. Thank you.
further questions or comments for the sponsor? Seeing none, are you ready to vote? All those in favor of sending House Bill 634 as amended to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward to full health.
Thank you, and thank you for your questions. I'll be sure and be better prepared. Thank you.
If you'd like to record yourself as a no on the legislation, please let Ms. Adams know. If you'd like to be recorded as a no, please let Ms. Adams know. Chairman Farmer has stepped into the room on item number 9. We are going to go back a moment into House Bill 1358. We have a motion, we have a second. Chairman Farmer, thank you very much for indulging me in your committee a few moments ago. It's time for us to indulge you. You have your motion and a second on House Bill 1358. You're recognized.
Thank you, Mr. Chair, and hopefully I've got everything appropriately filed this week. I've got an amendment, 3751.
We have a motion and a second on drafting code 3751. We'll go ahead and put that on the bill. All those in favor of placing amendment drafting code 3751 on the bill, please signify by saying aye. Any noes, please say no. The ayes have it. Your bill is amended, sir.
Thank you, Mr. Chair. Members, this does makes the bill a resolution. What does it request our Department of Health to ask the United States Department of Health to recognize or to add to the United States Uniform Screening Panel. So basically, a constituent brought me this, asked me to run a resolution or a bill to add metachromatic leukodystrophy, MLD. It's a rare genetic brain disease that can be tested for during the newborn screenings through a simple prick of their foot in newborn order to test the blood. The available for the screening is limited. It can be there's a set panel, I guess, newborns get tested for. I'm no physician, but I'm sure there are some here that can answer this. But just asking that we urge our Department of Health to ask the United States Department of Health to add this to that panel of screenings, just a simple test that they can detect this rare genetic brain disease.
All right, thank you very much. You've heard the description of that. And thank you very much for bringing this on behalf of your constituent.
Yeah.
It certainly means a lot to them.
Yeah.
Are you ready to vote? We weren't going to ask you to spell the situation. Question is called. All those in favor of sending House Bill 1358 to full health committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. You can work on your spelling in the week's time you have to get that bill together.
Thank you, Mr. Chair Committee. I appreciate your help.
Thank you, Chair. All right. Thank you very much for your indulgence as we work our way through the calendar. Again, going through the calendar, we're on item number 11, House Bill 566 by Chair Lady Carringer. The request has been to roll House Bill 566 to the heel without objection. House Bill 566 is rolled to the heel. We are now on item number Item number 12 on the calendar, House Bill 573. The request for item number 12, House Bill 573, is off notice. Without objection, House Bill 573 is off notice. We're now going to item number 13 on our calendars. Chair Lady Littleton. The request by Chair Lady Littleton, House Bill 709. Again, House Bill 709 off notice. Without objection. We're now going to item number 14 on the calendar. Item number 14, House Bill 1194 by Chairman Williams. You are recognized. We have a motion. We have a second.
Thank you, Chairman and members. This bill, last year, the Tennessee General Assembly passed the Colonel Thomas Baldwin Memorial Act. If the members will remember, we passed this act, and it provided respite care for Alzheimer's, the families of Alzheimer's patients. What this, currently there are 120,000 Tennesseans with Alzheimer's, and what this amendment would do, and Chairman, I forgot I have an amendment that I probably should add before I start talking about it.
You were doing such a great job, we were going to let you go on.
Okay.
But we do have an amendment code. You've got two different amendments. I'm told the amendment you wish to move forward is coded 5211. Is that correct?
That is correct.
All right, we have a motion, we have a second.
Yes.
Go ahead and get amendment drafting code 5211 on the legislation. All those in favor of placing that on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. You are on your bill as amended, sir.
Thank you. As I ran down the road there, as many of the members remember, my grandmother passed from Alzheimer's, and this is a really important topic across the state. What we find is that after a certain period of time for Alzheimer's patients, the family that takes care of that loved one is the one who really carries most of the stress in that environment. And we tried to develop a pilot program for 3 years to allow for this respite care to be provided on behalf of the families of Tennessee. And it's in a pilot project to find out if we could make sure that those Alzheimer's patients were able to stay in their homes longer, then it would cost the state less and it would be better care for them. What we found out since July, when the money went live for the program, is that there were some issues that we were having in utilization. What this amendment does is improve the overall utilization and add some additional things that can be covered by respite care. And I would appreciate the members' continued support. Thank you.
Thank you, Chairman. Chairman Terry, you're recognized.
Thank you, Chairman, and appreciate you bringing the bill and the support of the bill previously that you brought forth. And I do want to say that the other states, I think Florida started something similar, and they've had great success with that, and they've expanded it. And by expanding it, they actually saved their state dollars by saving the families having to go into care. And so I strongly support this legislation, and I'm just asking where the sign-on sheet is. So thank you.
It's quite a ringing endorsement. Thank you, Chairman Terry.
Thank you.
Further questions or comments for the sponsor? Seeing none, are you ready to vote? All those in favor of sending House Bill 1194 to full Health Committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward. All right. We're still on the calendar. We had hopped around. Chairman Crawford was chairing a committee, and we skipped over item number 8. Item number 8 is on the calendar, House Bill 469. We have a motion. We have a second. You're recognized on House Bill 469. Chairman Crawford, do you have an amendment? I do. Can you give us that drafting code, please, sir? Is it 5353? All right. Ladies and gentlemen, let's go ahead and place amendment drafting code 5353 on the bill. If you're ready to vote, all those in favor of placing drafting code amendment 5353 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. We are on your bill as amended.
Thank you, Mr. Chairman. Thank you, committee. Thank you for allowing me to chair my committee and come over a little late. Appreciate that. House Bill 469, it was brought to me by a constituent in my area from Bristol. There's a young man there who has autism, and his parents have looked all over the state of Tennessee. They've looked everywhere, all over the country, trying to find somebody that could treat this young man. His form of autism deals with his eating. He forgets how to eat, and they have to do a therapy session with him every week and basically teach him how to eat, and sometimes they even have to feed him through a tube. And so that was my desire, was to help this young man. because they found a doctor at the University of Virginia that was specialized in this area. So a lot of you are probably familiar with my area. Right down the middle of State Street, one side of the street is Tennessee, one side is Virginia. And so when they go do their therapy session, the very first question they ask is, are you in Virginia? And they could lie. They're probably less than a mile away from the Virginia line where they live. But they had such a hard time finding somebody that was able to treat this young man that they don't want to take a chance on doing anything that could, keep him from getting his treatment or losing that particular doctor. So they get up, they drive across the state line to the Walmart parking lot, and they do their telemedicine there in the Walmart parking lot with this young man with the autism disorder. And so what I'm trying to do is fix that problem. We have, reciprocity with several things. We recognize if you come from one state to here, you as a hairdresser, your certification is good. If you want to do fingernails, all that kind of stuff. But doctors, we do not allow reciprocity at this time. They would have to buy a Tennessee license and to be part of our compact and to deal with this young man. So that's where I am on the bill. The amendment basically sets the area that it has to be done from a state that touches Tennessee, and it also makes it require that this can only help children 16 age and younger. So that's what my bill does. I would greatly appreciate your support, but I'm here to answer any questions.
Thank you, Chairman Crawford, very much. I appreciate your advocacy for your constituents. I've spoken to the godfather of the constituent and understand the desire and your hard work on this piece of legislation. I think there may be some opportunities in the future to help this family in a very meaningful way. So I appreciate that. Ladies and gentlemen, are you ready to vote? All those in favor of sending House Bill 469 to full Health Committee, please signify by saying aye. Any opposed, please say no. The ayes have it. You move forward to full Health Committee.
Thank you, Mr. Chairman and committee, and hopefully in full committee, I will be able to have this young man and his family here to give a brief testimony. Thank you all.
Thank you. All right. Back on the calendar, we're on item number 15 on our calendar, House Bill 1455. The request has been to take House Bill 1455 off notice. Without objection, House Bill 1455 is off notice. We are now following the calendar on item number 16 on our calendar. We have House Bill 370 by Chairman Clemens. We have a motion. We have a second. Chairman Clemens, you are recognized. Any amendments on your bill?
No, sir. No, sir.
You're recognized, sir.
Thank you, Mr. Chairman and committee. What this bill seeks to do is require the Department of Health to actively seek and apply for federal grants and other available federal funds from the CDC or other federal agencies and utilize available federal funds for the purpose of implementing programs for the prevention, testing, and treatment of HIV for residents of the state of Tennessee. It also requires the department to report back to this body about each of those applications and the funds requested and used by the state of Tennessee. Now, ladies and gentlemen, it's no secret why I brought this legislation or why this legislation is necessary. Unfortunately, on January 17th of this year, the governor made the very short-sighted, callous decision to announce the intention to reject federal funding for HIV services, including testing, prevention, monitoring, and diagnosis across the state of Tennessee. In the past year, we received funds totaling about $8.3 million from the CDC for these purposes. And, of course, tied to those, each organization across the state of Tennessee that receives the benefit of these funds for the treatment and prevention and diagnosis and monitoring of HIV in our state, those funds are used for the 340B matching program. So there's a lot of more money tied to these funds than just that $8.3 million. Now, as you know, Shelby County has the third highest rate of HIV cases in the country. So losing access to these funds would be incredibly detrimental to the citizens of this state. Now, what this bill seeks to reverse is a decision by this administration that was on its face offensive, callous, and short-sighted with respect to a failure to protect the health and welfare of Tennessee families, but it was also fiscally irresponsible. Because what the administration said is, well, we're not going to take the funding, but we're going to fill in those funds with state tax dollars that we have in reserve. Well, and they have stated that. Well, the problem with that is that Tennessee taxpayers have paid this money to the federal government. Tennessee families deserve to receive the benefit of their hard-earned tax dollars from the federal government. So in refusing those funds, we're just wasting away that money we pay to the federal government, and now we're relying on Tennessee taxpayers again to pick up the tab. So they're essentially paying twice and in a fiscally irresponsible manner, filling in that hole. Now, also tied to that state funding, the administration has stated that they're going to shift the priorities of the program to prevent HIV among first responders, mothers and children, and victims of human trafficking. Now, while those populations certainly are worthy of this benefit of this funding, those populations don't align with the most vulnerable Tennesseans to HIV infection. By limiting HIV prevention activities to only 2% of Tennesseans who are actually at risk, the missed prevention opportunities in the state officials' plan could end up adding about $255 million in HIV treatment costs per year for the state of Tennessee. Again, another aspect to the fiscal irresponsibility of this decision. Now, the CDC estimates that 14% of Tennesseans with HIV are unaware of their HIV status, which means they're not getting the HIV prevention or care that they need. AMFAR estimates that preventing new HIV cases among those populations most at risk in Tennessee, who aren't going to benefit even when the state fills in that $8+ million, could prevent an estimated 509 cases of HIV per year. The CDC projected in 2020 that Tennesseans living with HIV would face an average lifetime cost of about $510,000 each. Now, according to data from the CDC and AMFAR, the failure to prevent 500 net HIV cases each year could result in as much as $255 million in additional treatment costs to the state of Tennessee every year. Now, as of 2020, there were 6,283 people living with HIV in Shelby County. 235 people were newly diagnosed. In Memphis, there were 6,589 people living with HIV, with 233 people being newly diagnosed. Rates of people with HIV in these two areas are over 800 per 100,000 population, much higher than the overall rate of HIV in the United States. So with all that information, committee, I appreciate your indulgence on this issue. Obviously, I'm seeking to right a wrong that was perpetrated by this administration for no other reason that is explainable. I mean, it doesn't make fiscal sense. It doesn't make any sense when you consider the long-term cost to the state of Tennessee by neglecting the most vulnerable populations. And then also, we really have a duty to protect the public health and welfare of Tennesseans. I think the decision by this administration to turn away those funds accomplishes very little other than some, I'd hate to speculate, but some political agenda. And that is speculation, I admit. But I don't know any other reason in this instance that such a decision, such a fiscally irresponsible decision, could have been made. And I'll just tell you, members of this committee, from person to person, I have seen firsthand a loved one suffer from HIV. I have seen what happens if you do not prevent HIV. I have seen what happens if you don't provide an early diagnosis and provide access to the best treatment to HIV. I have seen a loved one not only suffer, I have seen them perish and die from this terrible virus. This is a personal issue. But it's not just personal to me, it's personal to many, many families across the state of Tennessee, because too many have seen this personally themselves. And as you know, with viruses, they don't know county lines. Shelby County has the 3rd highest rate in the country, but that doesn't mean that only Shelby County is affected by it. Viruses don't know county lines or state borders. Every family across the state of Tennessee, from Mountain City to Memphis, is threatened by this virus. This is still an ongoing threat, regardless if you don't read about it anymore, regardless if it doesn't make all the headlines that it did years ago. This is a serious, serious problem that threatens the public health and welfare of Tennessee families. For us to refuse federal funding and bill Tennessee taxpayers twice and then redirect the money to target not even the most vulnerable populations, it simply doesn't make sense. I'd ask you to vote in support of this legislation to ensure that the state of Tennessee makes the fiscally irresponsible decision, makes the personally responsible decision in the best interest of the public health and welfare of all of our citizens, all 6.9 million Tennesseans. I'd ask you to vote in favor of this legislation. Thank you.
Any questions or comments for the presenter? Representative Mitchell, you're recognized.
Yeah, I mean, beyond just a health problem, I mean, this is fiscal malpractice by the administration. $9 million is 200 teachers or 215 state troopers. Y'all just think about that. You know, we could add 200 more teachers to the state of Tennessee or 215 more state troopers on our roads. You know, we just had everyone stand up on the House floor the other night talking about how we need to stop, you know, racing in the streets. Well, you can add 215 state troopers to this state if we just take our money from the feds. But, you know, that being said, I'll shut up.
Thank you. You all have thoroughly bashed the administration, and appreciate that. You've caught us at a time that that we're not going to be able to have the administration allowed to retort. We will have to adjourn this meeting, and we'll begin on this piece of legislation. We will bring the bill up to be heard, and we will begin hearing from the administration to respond to your comments. I will mention that we've had ongoing discussions about how well fiscally managed this state is. And when I made the last mention of how well fiscally managed this state is, one of my colleagues to my right said, wow, we take too much federal money. We're going to be in trouble when we take all this federal money. So, ladies and gentlemen, we can't have it both ways. There's an opportunity to discuss this legislation further. I appreciate where we are. All remaining items, including House Bill 370, will be heard next week as we adjourn.